we've got some special guests with us now. It's our weekly visit with Codington Connects, and maybe we can start with Sara Foust. Good morning. Thank you for joining us.
Good morning. Thanks for having us again.
Yeah, you bet. So you're on the board of Codington Connects. This is your third week now with us?
Yeah, I think so. It's been great.
Yeah, awesome.
Yes.
Thank you.
Yeah, it's been great.
So you brought a guest with you, Angie Collignon. Yes. Good morning.
Good morning.
So what is your official title?
Well, my official title is Substance Use and Justice Programs Coordinator. So I work for Codington County.
Okay. So you work for the county, and you're here today because you're involved in kind of a special program as well within Codington Connects too. Is that kind of the right way to pair that together?
Well, so she works for Codington County Community Services, which is a partner with Codington Connects, but we put the Restart, which is the program that Angie's overseeing, in the Codington Connects website and as one of the initiatives of Codington Connects.
Yeah.
So, yeah.
Like an umbrella?
Yes.
Maybe, or something like that?
Yeah.
Okay. So then what you put together just the other day was kind of a report that gives a nice highlight of what Restart has done for the community, mm-hmm. I think, for a lot of people. You want to tell us a little bit about yourself, and then maybe we'll go into those? Because I want to know about Angie too. So.
Sure.
How'd you get into this?
Well, as you know, Steve, I've spent the last, 20 years in court services working in probation, with the last 9 or 10 of those being specifically in treatment courts, drug and DUI court. And so in the early part of last year, the opportunity came to apply for this position. The county had received the COSUP grant, the $1 million COSUP grant. And Sara can probably give more background because there was a lot of people working on that for the year or more up to the date that I started. So I applied and started in April, which is when we really started working on implementing all of the ideas that the group had prior to my starting when they applied for the COSUP grant and that. I don't know if you want to give a little background on that.
That's how this initiative really falls under. We were really focused on what can we do to help justice impacted individuals in our community. So this grant that we received focuses on how we can support people involved in the justice system with substance use disorder. We received $1 million federal grant through the Department of Justice. So it was kind of a big deal to get the grant. It's a 3-year grant, and it covers a lot of different things. And so that was what the grant was. We were fortunate enough to be able to steal Angie and bring her on to lead this initiative, and it's been a fantastic fit. She's done an amazing job. And so the annual report that we just released is kind of the summary of what she's been able to accomplish last year.
I've just read through grants briefly, but I've seen $1,000 grants, you know, and I can't imagine what it took to do $1 million grant. So congratulations on that. And thanks for doing that, by the way. Thanks. Yeah. Wow.
Yeah. I mean, it really is a result of some great partnerships that we had a group of 6 of us that had agreed to be part of a national grant. We went to DC a couple times and did a lot of strategic planning before we actually applied for the grant. So some great partnerships between the Human Service Agency, the emergency room at the hospital, the judicial system, brothers and sisters behind bars, the police department. They were all really great partners in making sure that we could be prepared for this and have the right pieces in place to make it successful.
Awesome.
Mm-hmm.
Well, Angie, tell us a little bit about maybe collaboration. The report mentions post-overdose response team. Is that something that you kind of worked on yourself? Or
so that came about early when I started. So I started in April of last year, and right in April or May of last year, Watertown had a couple of overdoses that had occurred that made the news. And Emily's Hope out of Sioux Falls had reached out to us to talk about doing naloxone distribution, and then that kind of turned into the post-overdose response team. And so we started with them early on. They had reached out to actually Chief Toomey, who then invited me to a meeting with Angela Kennecke and some of her staff, and we talked about how we could do this. And because we had so much of the team already put together here, it just seemed to flow really nicely. So we did a couple different naloxone boxes, distribution boxes. There, one is at the emergency room. You just walk into the emergency room entrance and they are right there. And the other one is at the Watertown Library. So they were gracious enough to put those out. They're free. They're anonymous. You can just walk in. You can grab them to have on hand. They are not illegal to have. There are people who still think that maybe you're not supposed to have them. They are not just for people who have substance use disorder. We've talked about the different instances that the average person might need one. You could walk into the bathroom at Walmart. You could walk into a gas station. You could have an elderly parent who mixes up their medicine. There are many, many reasons that somebody might carry naloxone. And so we've really been happy that we have found that we've distributed over 800 units of naloxone in our community since we put those out. So,
Wow.
yeah, there are other boxes around that the Human Service Agency has done with the Department of Health, and those are located strategically at like schools, Lake area. They're usually by an AED, and they just have a couple of doses in there that you can grab in case of an emergency. But the ones at the hospital and the library are ones that you can take with you and keep just for an emergency.
And when you are kind of talking with recovery specifically, those that might be with someone that is going through recovery, to have access to that can be important because, you know, if someone does have an overdose, they can bring them out of that. And maybe that's the time that they seek recovery, and it's the time that it takes.
And exactly. That's the post-overdose response team. And so what happens is there's a peer support specialist. So we have Jessica Cooper in Codington County who her position is funded through our grant currently, and she works for Face It Together, which is an organization out of Sioux Falls that specifically works through peer recovery. So meaning that she has lived experience with addiction. She's been to prison. I think she's close to almost 10 years sober now. She's amazing. She just has a relationship with those who are suffering from substance use disorder that those of us who haven't just don't understand. And she can really get through to them. So throughout this process, then Emily's Hope has now contracted with her on us separately to respond to any overdoses. So what would happen if somebody would go into the ER with an unintentional overdose? They would activate our port team. And so they would call Jessica. She would be able to meet with them at the hospital if they were able, maybe the safe room if that's where they get taken to next. And then really start talking to them, not only about recovery, what resources are out there, support groups, individual kind of one-on-one support with her. But also if they're not quite ready for that, she can work on harm reduction tools, and she can also work with the loved ones of the person who overdosed in order to help them find support within our community. Because we do have a lot of great resources in our community, but I don't think until you're in the situation, you seek them out, and then to find them is hard. And so having somebody who just has all of that, we give them a little kit that does have naloxone and all the resources in it. Having someone just bring that to you and offer that information and be that listening ear and somebody who has all that knowledge is just really valuable in that time.
Wow. Very good. So talk a little about adult diversion. It seems you achieved a 90% completion rate for the adult diversion program. What does success look like for 84 individuals who avoided court?
Yeah, so adult diversion started on July 1st of last year. It was a partnership through the judicial system and the state's attorney's office. We sat down and looked at, basically, I printed out every offense that was charged out in the criminal justice system in 2024. And then we looked through that list and decided of these, which ones could be eligible for diversion. So most of our diversions come from young adults at 18 to 20-year-olds who are getting an underage, maybe have a fake ID. We have done some marijuana, controlled substances, because ingestion of a controlled substance is now a misdemeanor. So some of these young adults who are just not have fully developed brains and not necessarily making great decisions yet, we've been able to work on through diversion. So with that, each one will go through some sort of prevention class. They will either work with the Human Service Agency and their prevention group, or if they are a Lake area student, they have their own program for their students there. So once those are approved through the state's attorney's office, I contact each individual. I meet with them, talk to them about what it would require for them to complete a diversion, what the benefits are, what happens if they don't. It is voluntary. They don't have to do it. And then they decide whether or not that fits, what their goals are in life. And so of the 90% who completed successfully, probably 5 of those 10% who didn't just declined. They were just like, no, thank you. I'll just pay my ticket and move on, because that is the option on an underage. You just pay a ticket and you move on. But with diversion, we'll have you do the prevention class. Everyone is required to do some amount of community service. So they're giving back to our community. And then they do have, it does cost for those classes, but we do intentionally keep it about half the amount of the ticket as an incentive for them to try to incentivize them to do diversion over just paying their ticket. So,
nice.
Yeah.
So you also mentioned like Brothers and Sisters Behind Bars provided over 2,100 nights of housing. So why is sober transitional housing the missing link, if you will, for many people leaving incarceration?
Well, I can tell you, when I first moved to Watertown and started drug court in 2016 or 2017, we didn't have Brothers and Sisters Behind Bars. And as the probation officer in drug court, we had participants in our program who had nowhere to go. And I can think back to a couple specific examples who were either just kind of couch surfing from house to house to house, but they never had a sober environment, which really didn't give them any ability to try to stay sober themselves. There are a couple of people that ended up getting discharged from drug court and going to prison that I know, had we been able to provide them some of the housing assistance and support that Brothers and Sisters Behind Bars had, they would have probably had a different outcome. So once Brothers and Sisters Behind Bars came into the picture, as the drug court officer, they're like, we will do anything to keep them happy, because they have provided so much support and so much benefit to those people who are living in their home. I'm sure that it's hard to understand, but if you do not have a safe, sober, supportive environment when you get out of prison, when you get placed on probation, if you're trying to start being in recovery, it is exponentially more difficult. So.
Yeah. Go ahead.
I was just going to say, and that was one of the things as our team decided what we were going to prioritize with the grant. And when I wrote the grant, that was one of the big areas that we knew that we needed to keep consistent, and we needed to give them some assistance so that they could create a sustainability plan. And so that's really been our goal with the support for Brothers and Sisters, is that we can have a sustainable plan for sober living in our community long-term. It was really important to our team to have that part of it.
Yeah, I can. I mean, it's already difficult to kind of, find a job and a place and all these things just, in a typical situation, let alone if you have to come out of being in jail for, I don't know, a year or whatever. So I couldn't imagine something like that.
So the other thing with our housing program is that if you are required, or if you are in the house, you are required to participate in peer support for at least a month, so that you just kind of get the feel of that and hopefully stay in it after that. But you are also required to do case management with someone in our office. Carrie Cranbrink does that. And so that she is working with them to maybe get their documents if they don't have a birth certificate, social security card, find stable long-term housing. She works with them for employment, medical, any other things that they might need to really give them that strong start and foundation to begin rebuilding their lives. So that is another component of the housing that really helps make it successful.
And I don't think that they realize too how difficult or complex it can be when you're dealing with a lot of those different situations at one time too. You talk a little bit about where was the thing? Okay, excuse me. You had tell us like these social events. You had a recovery fest.
Yeah,
tell me about that.
Yeah, so our grant with supporting Brothers and Sisters in their housing, besides being sustainable, one of the other things that we really wanted to do was as if they could refocus some money on really providing sober events for people in our community, because again, coming from the drug court system or the treatment court system and working with people in recovery for the last 10 years, there's not a lot of places you can go that don't serve alcohol.
Mm-hmm.
And so even in the treatment court program, like you're not allowed to be in any place that serves alcohol. So that really limits your eating out to very, 4 or 5 specific places, things like that. And one of the biggest things is once you get your use, I wouldn't say under control, but it's just a little bit more under control than it was, people start to get really bored. And that's when they really start to get in trouble, is when they get bored. They start looking for, like, they used to love to play darts. They used to play pool. But those things all occur in bars, those kinds of things. And so one of the focuses of Brothers and Sisters Behind Bars has really been to focus on positive, social, sober activities for people to participate in. And so Recovery Fest last year, was that in September? I believe, turned out to be a beautiful day. They had a cornhole tournament. I think they had over 250 attendees. We were down at Foundation Plaza. It was amazing. And so they've done other big ones like the Zoo Day. The Christmas pictures that they do every year are amazing. They started that years and years ago. And I remember, again, working in the probation system, so many families have never had a family picture. And they have a volunteer photographer come in and take the photos. They set up a beautiful backdrop, take family pictures, they print the pictures and provide them to the families. It's they dress up, the little girls have their dresses on and bows in their hair, and it's just a really great day. And then they do a lot of smaller things. So they have like Recovery Smoothie Day. I can't think of what they actually call it. Smoothie Day. They do, they started a men's group now on Saturdays. Just lots of different events to keep people busy.
Mm-hmm.
So
how does somebody like get into a program like this? Do you get in trouble and you apply? Do you get in a certain kind of trouble? Can you ask ahead of time? How does it kind of work?
For like Brothers and Sisters or like Restart in general?
Yeah.
So with the diversion program, you have to be ticketed. So every week I go through all the tickets that the police department, the sheriff's office, and the highway patrol have written and review who's eligible and who's not. And so those ones I have to contact you, and then it does have to be approved through the state's attorney's office. So they are the return. But housing, those usually come from probation and parole. They do only accept, for the most part, people on probation or parole. That helps them a little bit keep their house sober, have a few more rules around those individuals who are staying there, things like that. Recovery events, just walk in, like where they have a BSBB, Brothers and Sisters Behind Bars, has a Facebook page that announces all their events all the time, those kinds of things. So Brothers and Sisters, again, you just walk in, they serve coffee all day, every day. They have an amazing latte machine that people just walk in, have coffee, and get some camaraderie.
Mm-hmm. And so people can, they also you'll do like treatment graduations sometimes too, and post those, and people can check those out too. And part of these are like success stories as well that they can check out. So there's even some social media involved if they want to go online and kind of check that out as well. Right?
Yeah. So we started, one of the parts of the grant is we started working with a marketing company. They're Production Monkeys out of Aberdeen. They have been amazing. They have started, so Codington County Restart is the name of our initiative. We have presence on Facebook, Instagram, and YouTube. We had 6 individuals tell their recovery stories, and Production Monkeys recorded those, did the interviews, and then have broken those up into small just snippets that they put out on social media each day of each of these individuals talking about their stories. And knowing each of these individuals personally, I'm just very proud of the work that they've done, not only personally, but to put themselves out there like this, not knowing what kind of feedback they would get. It has been nothing but positive. We now have people reaching out to us asking to be able to tell their story, which is really exciting. We're working on a way to do that, which but on our Facebook, Instagram pages, we, at the end of 2025, when we did our annual report, we had over 250 1,000 touches on that. So whether they interacted with a comment, a like, a share, any of those kinds of things, the reach of that social media campaign that we have going on has really been impressive to me. I had no idea that we would get 250,000 different touches on those pages. So that's been really exciting.
Wow. So if somebody just said, what's the point of all of this to take someone and try to divert it or try to make them, productive, I guess. What's the whole point of all this in the end?
So there's a couple of points, right? We want to support people in our community. We want them to know that recovery is possible, that there are resources out there to help them, but also addiction is expensive. And so for those people who maybe don't live with addiction in their lives at all, the cost to the justice system, the cost to the detention center, the cost to the county with court-appointed attorneys' fees, and just the cost to people's well-being. The employers in town, they have so much turnover with people, in or that have substance use disorder. And so working as a community in our community, not only to help a lot of young people who make bad decisions learn from them and move forward, but also all of those others to understand that recovery is possible, that it does have a very large social impact on your community, whether it's getting your cars broken into or all of those kinds of things. It's numbers for the police department. I mean, it touches so many things. If you don't think it touches you individually, it does. You just have to really think about how that impacts. One of our goals is really to reduce the strain on the judicial system and the defense attorneys too in town. Like they just, the cost for the defense attorneys to the community is enormous. And I know it's a big deal to the commissioners. And so we've really been working on how we can help with those kinds of things too. So there's not only the personal cost of each individual who suffers from this and their families, but then there's the community cost too, with all those other resources that are being used.
Yeah, absolutely. And I always remember when you're looking at an individual and everybody seems to, they love the success stories and the end and seeing family and crying and all that. But when you see someone in the midst of addiction or, all that, I try to remember the success stories that this person could be, that individual,
right?
And it's so hard to say, give them another chance and so on. But anyways, try to remember that, that's possible if that recovery is available.
Yeah.
And
even we all love treatment court graduations, right? They're great. But we still provide each of those individual support afterwards, because just because you graduate from treatment court doesn't mean you're cured. It's still a battle. I try to tell those who don't understand addiction to think about dieting or exercise or smoking, something that more people can relate to. How many times have you started a diet and quit and started and quit and started to quit? Like, what have you done that you have been able to maintain for a lifetime? Because most of us probably don't really have many things that we could maintain for a lifetime. And so thinking about that, just because you've had a year of sobriety or 2 years of sobriety, that fight it gets easier, but it doesn't go away.
So is there things on the horizon that are coming that you're working on, or is this kind of you're continuing the efforts and hoping that it just continues to expand and you can involve more people?
We're definitely continuing the efforts, but yes, we do have things on the horizon. One of the big projects we're working on right now is starting what's called pretrial services. And so what that would include is we have a working instrument called the public safety assessment. So anybody who has a bond hearing coming up, we would complete this document. It is a validated risk assessment that assesses someone's risk to fail to appear to court. So are they going to come to their next court hearing? While they're out on bond, will they reoffend? If they reoffended, would it be violent? And so based on that is provided to the defense attorneys and the judges. And it's just a very objective instrument that rates those couple of things. And it allows the attorneys and the judge to make a decision based on equal information for each individual that comes in front of them. It is not a tool that tells you what you have to do. There's obviously still arguments that are made on both sides. It's just a tool that they can use in judging whether or not the person would be a decent candidate for bond, and then what kind of bond. The other side of that is that for those who may have a riskier assessment of their ability to remain out on bond successfully, we will provide supervision to that person. So we can help them make sure that they're getting their bond conditions met. So one of the things that I have to remember coming from probation is that these individuals will not be convicted. They are still presumed innocent. So we are really just a supportive role. We need to make sure that they get to their 24/7 on, within what they need to be doing in order to stay compliant with their bond. If they need to get a treatment needs assessment, we can help them set those up. If they're struggling with housing, food, Medicaid, different things like that, we will provide that support to those person. That, of course, part of it is voluntary. The part that we really will work with them on is making sure they are compliant with bond and the law, so that they don't end up back in jail while they're out on bond. So that is one of the things that we're currently working on. Hopefully that will be going here in the next couple of months. We will be meeting again next week with the judges, the state's attorney, the defense bar, to really work on what that needs to look like and how we need to go through that. So we're hoping, again, we can reduce some failure to appears. We can reduce continuances in court, which then reduces court-appointed attorneys' fees. We get people in and out of the system faster. And really start moving things along and helping people become more successful before they end up on probation. So right now we have too many people that are waiting out on bond for 3 to 6 to 9 months, just kind of hanging out, where if they're receiving services during that time, they could be 3 to 6 to 9 months ahead of where they would be if they get placed on probation afterwards. So.
Wow. There's a lot of like investigating or researching, learning, and then how to piece the solution together.
Yeah. So luckily for us, there are obviously lots of people already doing this in the country. But in South Dakota, Minnehaha and Codington County are actually already doing it. So they've been a great resource to us. And of course, they're much larger and different than we are, but the processes are the same. And looking at me learning from them and then taking that information back to our team and then tweaking it for what works within our community.
Wow. Well, is there anything else you think we should know about Restart, kind of while we've got you here to pick your brain a little? I mean, you got some really good updates too, but I don't know. Is there anything that we missed? Because we're going to do a nice little release on the whole thing too, but I want to make sure that we didn't miss anything that you wanted to get out specifically, straight from the heart.
Straight from the heart. No, I'm really proud of the efforts that have gone on. This started long before me. The vision and the mission started years before I started. So when I came on in April, it was just my job to take it from a vision to implement it. And so that really has been what I've been working on. We've had really strong partnerships with, like she said, the police department, the hospital, brothers and sisters behind bars, the judicial system, the state's attorney's office. There's been a lot of people involved in this, even though we are from Codington County Community Services. It is not solely our project. And so it really has been a community effort. And proud of the people who have been involved in it, proud of the people who are willing to share their stories and show what's going on, and really just excited about what's up to come yet for the next year.
Well, and I think on top of all of it, on a personal note, I know that sometimes it can be a difficult and complicated position, if you will. I know that the individuals can be complicated. And so I appreciate what you do. And so the community should recognize that, I think, as well, because it's one thing to just go to work, and we all have that thing, like, oh, I got to go in. But you deal with some pretty frustrated folks sometimes that are down and out, and you do it every day. So appreciate that. And
thank you.
And you're trying to make a difference in their lives, which is even more difficult sometimes.
Right.
So,
yes.
So thank you for that. Appreciate it. Sara, I want to make sure too, we help maybe support some of this that's going on. Is there still some tickets left for like the murder mystery dinner kind of thing going on?
Yeah. So that's happening this week. That is supporting Connects initiatives to support other initiatives and organizations in the community. And so I think my understanding is we might, after tonight, it might just be at the door sales, which is a very limited number. So if you're still interested in getting your tickets, get them today. By the end of the day, we've had really good sales, and it's just going to be a great event.
Wow, awesome.
Mm-hmm.
And so the proceeds will go to benefit Codington Connects, which does all this in over 45 organizations.
That are partners. Yeah. We partner with we have 45 organizations that are partners with Codington Connects. And that's what we want to do, is just get out there and support the work that is happening in our community. Let the community know all of the resources. And so the Mystery Dinner Theater will help us be able to promote those organizations and support the work that is happening. Mm-hmm. Let the community know what's happening out there.
Yeah, very good. Yeah. Because Codington Connects is a 501c3 nonprofit.
It is now, yes.
Yeah, so it's a legitimate nonprofit, and the belts get tightened for nonprofits federally, by the state, all over the place. Yeah. So to get that message out there, you need help and you need partners, and this is a fun way to do it.
Yeah, it is, and to highlight the work all the partners are doing too. Yeah. So the Mystery Dinner Theater is Thursday, Friday, Saturday at 2nd Street Station. It's a 3-course dinner involved with a little bit of mystery and some investigating that happens there.
Yeah, nothing like some locals acting, and you can try to kind of mess with them a little, see if you can get them to break character, and a good meal too, all for like $40, right?
Right. Yep, $40. Yeah. It'll be more at the door.
Yeah,
for those tickets that are available.
So get them today. Wednesday, February 16th.
That's right.
18th.
18th.
I don't know.
Yeah.
You're bugging me. Okay. Did you want to mention anything else?
No, this is great. Thank you for letting us share and letting Angie share all the great work she's done through the Restart.
Yeah, absolutely. Initiative. And the Restart has its own Facebook page and Instagram, right?
Yes. So Codington County Restart on Facebook. Instagram, it's CodCo Restart, because they require different, lot less letters.
Yeah.
Or if you're sharing our annual report at some point, there will be a link in there, and there are QR codes that you can scan to go straight to our pages as well.
Oh, that's some good technology right there. I like that.
That's what a good marketing company does.
Yeah, nice.
Yeah, and we'll get the annual report posted on the Codington Connects website as well, under the community initiatives page.
Awesome. And if you do go to Codington Connects, there's tons of other information on there as well. All the links to the other 45 some organizations that you partner with, and their social, and the member of the month, and agency of the month.
Agency of the month too. Yeah.
Okay.
Yeah,
Anything else?
No, that's great. Thank you.
Okay, awesome.
Great.
Well, you guys did really good. I appreciate everything that you guys do. Let's get back to a little bit of music here, and then we'll see you next week, right?
That's right.
Next Wednesday. Might have another new guest for us.
I will have a different guest.
Yes. Okay, cool. Well, let's see. It looks like there's an ad that's stuck in here. So we'll get you back to that, and then we'll do some music on Northeast Radio SD.
This is